NSS IIT Roorkee is the largest student body group of IIT Roorkee that aims to bring out pragmatic solutions across all domains of social service. And we are proud to present our talk series, Her Women of Wisdom. The motivation of this initiative is to invite women from different walks of life who are working for a cause and bring their voices to you. We believe in empowerment through knowledge and throughout culture and gender. Our aim is to give you an intellectual stimulation on various topics and motivate you to concentrate your energy on various empowerment causes for the nation. With this note, I would like to introduce our very first guest, Dr. Purnima Mani. A very warm welcome to you, ma'am.
Thank you.
So, Dr. Purnima is a renowned social scientist and an expert in gender, HIV, and sexual and reproductive health issues. She has worked for over 12 years as an associate professor at the Tata Institute of Social Sciences. She has held senior management positions in the UN and international non-profit organizations working in the field of global health and development, including the UNFPA, the Global Fund to Fight Tuberculosis and Malaria, the Council, the UN AIDS, and the World Health Organization. She has co authored and edited 4 books, including one of the first books on social and cultural aspects of AIDS in India. As a CEO, she led the Pathfinder International in developing groundbreaking programs on sexual and reproductive health in 20 countries. Thank you for joining us today, ma'am.
We are very
Pleasure.
grateful to have you, ma'am. Your work in the field is an intricate one, and a lot of questions arise in our mind when we dive into this topic. We look at a lot of information and opinions, and somewhere get lost about the true facts. My very first question to you is: women represent almost half of the people living with HIV. According to WHO reports, 17.4 million adult women are now living with HIV. This number is more than ever before and is on the rise. Can you tell us how and why women are significantly affected by AIDS epidemic?
Thank you for that question. In fact, UNAIDS recent data of 2019 indicates that the number is 19.2 million adult women living with HIV. So it's gone up even more. And it's constantly been rising. And this number represents more than half of all adults aged 15 and over who are living with HIV. It's important to note that adolescent girls are more at risk due to a variety of factors. You know, many countries, early marriage when they're very young, so they don't really have much control over their lives. Denial of information to young people and violence. Those are some of the reasons. But it's a perennial and growing problem. Women are consistently have been affected by HIV more than men. Across, I've been studying HIV and working on HIV for many years, and it has never changed. Both in terms of infection rates, which are higher, and generally affected by the negative consequences of AIDS. And I'll talk a little bit about that. Women's vulnerability, as stated by UNAIDS, is a combination of very complex factors. There's social factors, there's economic factors, there's cultural factors, the gender inequality, poverty, unequal power, violence, social isolation, you name it, limited access to education. Everything that impacts women for other problems also impacts them in the case of HIV. If you look at global health, that is our story, a sad story, in fact, about women. They're always disadvantaged and more impacted than men. They can't make very many choices about their health care. Even also the fact that they have higher levels of domestic work and caregiving responsibilities makes it a real challenge for them. So even when they don't have HIV, they have to look after somebody who has HIV. And that, makes the problem even more complex. And you might well say, how is this different? This is the story of women's life. But in the case of HIV, what happens is due to its association with sexual transmission, it means that gender norms related to sex and reproduction make this whole problem more complex because they are much tighter, they are much more rigorous than all the other norms, and women can't really protect themselves. So the rates are high overall because of unequal gender norms And when they are, as I said, when they are not infected, they continue to remain vulnerable. They are also impacted negatively by a variety of other things that are assigned to them. Sometimes they cannot even finish their education because there is one family member who has HIV. They are not permitted to go to school. They have to stay at home and look after the person. Or they have to stay at home and take over the economic responsibilities of that person, which means they cannot finish their education. So there are a variety of ways. I could go on and on, but one thing I want to say is when women have HIV, the good news is that women who have HIV are more compliant in their treatment and whatever they are asked to do by the doctor. That's a very interesting fact. Because one would imagine that they wouldn't be so compliant, but they are. If they're told to take the drug twice, they'll take the drug twice. And that's been researched. And data shows that they are extremely compliant. Then why are their numbers so high? The numbers are high because the men don't listen and follow that advice. So as a result, what happens is even when they are compliant, they often have to suffer the negative consequences because their partners don't. I'm not putting all the blame in the path of men, because it has to do with the way society has framed things for men and women. But there is this interesting fact that if women are so compliant, shouldn't they get the rewards of that compliance? But unfortunately, they don't. So I'll stop here if that's okay with you. But if you want something more, I can give you something more.
All right.
That's fine, ma'am.
So, ma'am, in your opinion, what would be the top priority intervention to reduce women's risk of HIV?
The top priority intervention, it's very difficult to single it out because it's the same top priority intervention for changing the status of women. Give women services, knowledge, information in a way in which they can, use it more effectively, make society more culturally compliant and more open to letting women practice what they're learning. And especially, I would say, the men, make sure that the men understand that it's not just in the advantage of women, but it's in their advantage. If they have a wife who is protected from HIV, wouldn't it be good for their children? Wouldn't it be good for them? But we don't ever take that tack. We tend to focus on, women and men, but we don't bring them together and say, you actually, whatever we do for one impacts on the other. So let's, do this in a joint way. Also, we don't provide services where they are more effective for women. Women don't go everywhere. Getting out of the house to get a service is so hard for women. And in Pathfinder, I found that one of the projects we had, in fact, in India, was going to door and providing information on maternal health. In that case, it was maternal health. And women were so interested and open to that information and wanted to go to the maternal health center, wanted to work with the ASHA. Why did that happen? Because you went to their door. They can't get out of the house and go to a center. It's very hard for them with their children, with their cooking, with other things they do in the house. So our services have to be women friendly. And I think that's something that in the case of HIV, to some extent, we were able to do in the case of prevention of mother to child transmission. Those services were developed to be very women friendly, and that's why women access them more. And obviously, the government supported it fully. They were very much, every government has supported prevention of mother to child transmission. You know that is less controversial than supporting condoms. So they always have supported prevention of mother to child transmission. And that's why, and made sure that women could access those services. So I think creating interventions that help women to exercise the choice to act on the information they have is very important. Not just giving them the information. All of us are surrounded by information, right? But how do we act on them? It's only when we feel empowered that we can act on it. It's only when your father or your mother or your husband or your brother says, yeah, go ahead and do it. I'm standing with you, that they can do it. And that needs to happen. And that's why I keep saying you need to work with other influencers around women as well as women. You need to empower the women, but you need to create a congenial environment for them to act on that information.
Okay, so the next question is a study published by Guttmacher Institute found that contraceptive services and maternal and newborn health services fall far from needs in developing regions. 214 million women were not using effective method of contraception. What do you think can be the reason for the lack of these services?
Well, one of the things, let's be clear. Are we talking about lack of services being available or lack of services in terms of being used? I think the problem is a little bit of both. We do have relatively limited services, especially in rural areas, remote areas, services for women who are not part of the mainstream of society. There are limited services, and definitely an effort has to be made to target women in terms of making sure that different kinds of women get services in different places. That's one thing. But also, you have to create a desire, you have to create a demand. Demand and supply go hand in hand. So you have to generate the demand for those services. Many a times the services are there, but they're not being used. So, is it a question of limited services or is it a question of limited usage of services? I think it's a bit of both, and we need to work on both of these. Contraception in particular has always suffered due to, because the question is on contraception and maternal and newborn health, if I've got it right. Contraception has always suffered due to the polarization in viewpoints around women being able to control their reproductive future. How many children to have, when to have them, when to stop having children, sometimes even who they're going to have the children with. They really have very little control in many contexts. Maternal and newborn services often fall short because they just can't keep up with repeated pregnancies, the continued inequity between urban and rural areas, which makes it very, very difficult for, you keep expanding the services, but they keep becoming shorter, not enough. That is the problem we need to keep in mind. The main cause also is not enough gap between pregnancies. Women have, one child after another, which becomes a problem. So there's a lot of demand for those services. They're always going to fall short. Early and multiple pregnancies, high number of unplanned pregnancies. A lot of times you have good intention, but because you don't access the services or use them correctly, the contraception, you have an unplanned pregnancy. And pregnancies because you can't get the access to the contraception when you want it. That's called unmet need. You want to use it, but it's not there. You don't know where to go for it. So all of these are very important reasons for why even maternal and newborn health suffers, because contraception is linked to maternal and newborn health. And those services need to be seen together. There have been some efforts to innovate in maternal and newborn health. In India, for example, this whole program for skilled birth attendance and pushing that, making sure that women have access to skilled birth attendance, has actually made it possible for children to survive longer. And when children survive longer, women are less likely to be anxious about having the next child because they're not worried about losing this child. And that's an important factor that has impacted on many children. Also, financial incentives have been given. For example, sometimes you have one girl and the family wants to go in for more and more because they want to have a boy. And there have been states that have offered financial incentives if they have one girl and no more after that. So there are ways in which, you can address this, but quality services are important. Adequate services are important, and acceptable services are important, culturally acceptable for women, the society in which they live. They have to be included in order to, reach the goal that we have of getting all women covered by contraception to the extent they want it, and of course, maternal and newborn health services.
Okay.
All right. So, ma'am, it's been more than a year since the COVID-19 outbreak, and it's still going on,
Yes.
and things have drastically changed. So, what is the impact of COVID-19 on programs and initiatives that are for women and girls, like the safe motherhood programs and school vaccinations and integrated family planning and all?
Data on this is still coming in. We don't have full coverage because I looked at some of the data, but all we know is that the pandemic has had a devastating impact on all health services, other health services, and socioeconomic services. Um, the lack of access to schools in particular, and the pull for health workers towards working on COVID, they've taken everybody away and made them work on COVID practically. So I went, for example, I live in the US and I went to a US hospital for non COVID related service. There's nobody there. Very few people, even patients, very few, because they are worried about, going to a hospital in such a situation. But also, in terms of the people who work there, they are very limited. And so you get very few and scant appointments. Now, in the US, you can do it, but can you imagine in India? It would be impossible, to manage that. And I think that's part of the problem. Safe motherhood programs and integrated family programs, according to me, family planning programs could and must continue. And they could actually continue along with COVID programs. If we are innovative, we have been very innovative in many, many ways. But somehow the priority for everything other than COVID has started dropping. And that becomes a problem. But I also want to flag, I won't let anybody off the hook. Generally, women's health always gets low priority, as does sexual and reproductive health more broadly, whether it involves women or men. And of course, the shifting of financial and human resources to fighting the pandemic has had an impact, but also let's not forget the priority to this area has always been low. And that is something, we shouldn't lose the gains that we have made in this area. We have made gains. We shouldn't lose them. We should continue to stay on that path. And, I'll give you an example. In some countries, when you go to the doctor, no matter for what, you go for a cough and cold, or you go because your back is hurting. At the last question is, do you feel safe in your current environment? Are you being abused in any way? Now, that has actually nothing to do with my backache or my headache or whatever. But they always ask that question. Why do they ask that question? It's because people don't go for easily for those kind of services if they are being abused, or it's very rare that they will themselves go because they'll feel obliged. My family will get upset. My husband will get upset. So they take advantage of the fact that the doctor patient are alone and ask those questions, because the doctor then has the right to report it and somebody will investigate it. So I feel like we have to become a little more creative in terms of our services and how we integrate them. If we ask the right questions in our services, we can at least point them to where to go, because people don't know, in any case, where to go for, everybody's talking about COVID. Who's talking about family planning? Nobody's talking about it. Who's talking about maternal and newborn health, other than saying to you, why you were pregnant at this time? You shouldn't be pregnant. That's what a lot of women hear. But they are pregnant and they need care. And so pointing that out to them in that time would be, according to me, those are essential services and they need to be provided.
Okay, thank you, ma'am. So the next question we have is, a few months ago, India released its new national education policy, which was being updated after more than 3 decades. and some of the big changes were expected. Yet there was one major chapter missing: sex education. According to T.S. Satyanarayana Rao, a renowned psychiatrist, sex education is deemed unnecessary because people feel it comes naturally. What is your take on this?
You had one more question on sex education. Why don't you ask that and I can address both together?
Okay.
So Indian schools do not provide Indian schools do not provide proper education to teenagers about reproductive health, and teachers are also not that open to talk about it. And only 45% of young men and 28% of young women seem to have a comprehensive knowledge about HIV/AIDS and its prevention. Whereas in the Netherlands, they are given sex education from a very young age, which has excellent impacts, as it has one of the lowest rates of teen pregnancies and sexually transmitted diseases. And it is also one of the most gender equal countries. How can sex education serve as a tool for gender equality? And how can Indian schools help in improving this?
Since I had the opportunity to look at the questions in advance, I found these two questions fascinating, and that's why I took them together. Sex education has always been a polarizing issue. When all evidence suggests that, in fact, it prevents the very behavior that some of those people who worry about sex education, premarital sex, increase in abortion, all of those worries that they have if you give sex education, actually, none of those happen as a result of sex education. They actually go down. And that is the hard data that unfortunately is very difficult to sell to people who have a bias in their head that sex education is going to be harmful to young people. It prevents, all the data shows that early initiation into sex is actually reduced because of sex education, unless, of course, you get married early, like in countries like India, where you don't really have a choice. Then, it's a different matter. But as something that you do on your own, it definitely goes down. It encourages people to protect themselves from both pregnancy and STIs and HIV. It also avoids unintended pregnancies, and it reduces, there's data to show that it reduces STIs and HIV. It also lowers abortion due to unintended pregnancies. What more do you need? You have this data. Young people, according to me, need the correct information, and they need the social encouragement to act responsibly for their own need and for others' health. Because their sources of information are often informal, they're often completely wrong and misguided, and they make them act in a way which is actually harmful for them. They are told, if you sleep with a virgin, that's good for you. Your STIs will be cured. All of these things come from sources of information which are complete rubbish. And how do you prevent that? The problem is who gives the sex education. You mentioned teachers, right? If teachers are also often consider themselves carriers of culture and cultural values, you have to train those teachers. You have to work with them in order to bring them to a mindset that actually comes to respect sex education and what it will deliver for young people. Otherwise, I would rather, can you imagine a young boy listening to a teacher about sex education? No, he's not going to be a happy camper because he's going to be terribly embarrassed. So, the best educators are peers. I've worked with various programs where you train young people to provide sex education, and they do a phenomenal job because the young people can use their own language. They can feel comfortable and ask embarrassing questions because this person is someone they don't know. He's not from their environment, so he's not going to go and tell his mom or pop or anybody. But at the same time, he gets it because he or she is from their environment and of their age, and yet has the complete, not just the information, but also the appropriate attitude towards it. I do want to say that, we as a society have a responsibility to our young people, not just this provision of services, but building their confidence to act on them. Not just for young girls, but also young boys. And I keep emphasizing this because I think we don't focus enough on young boys. They are as malleable and shapeable as girls are. So we need to educate them at the right time. And the informal sources often perpetuate gender stereotypes that are harmful. Oh, women don't care. When they say no, they actually mean yes. That is perpetuated by the, by the kind of information they get. But I think one fallacy I want to rule out is sex education is not really about how to have sex or only focused on sex. And I think that's the problem that many people have when they use the terminology sex education. It's not just about contraception, STIs, HIV transmission, all is included, yes, but it goes much further. It's about learning life skills. It's about learning family life education, how and when to say no, learning to negotiate around sex, planning your families, respecting yourself and your partner. Don't allow yourself to be abused, for example, is a very important message in sex education that girls don't get. And boys, again, as I told you, don't get either, that women's bodies are their bodies and you have no right, just because you're a boy, to violate them in any form or touch them in any form. And I think that's something that comes through the kind of sex education that's given in the Netherlands. Not just about how to produce babies and how babies are born. It's not, birds and the bees. And that's important. I think young people would benefit tremendously from this kind of, it's a perspective shift, if you can get my meaning. It's changing your way of thinking, and it's or shaping it, even if it's not there already, you're shaping it. And I think that's important. And that's why the Netherlands has the lowest rates of teenage pregnancy, STIs, all of that. I think when it is assumed that some things will happen organically, yeah, some culture, for example, cultural change, it happens. Some of it happens organically. Nobody needs to do anything, it just happens. But a lot of it needs help, it needs support, it needs promotion, it needs data, it needs to be evidence driven, it needs to be conscious and responsible. I'm adding a lot of adjectives, but that's what actually sex education is. It's very conscious, it's responsible, it is evidence driven, and it is provided by people who are trained in it, not just off the cuff, giving information. Learning it naturally is a risk that I don't think any country should take. Even when and if it happens, I think it will involve considerable delays. When you could have, it's like doing something too little, too late. And you don't want to do that when it comes to the lives of your young people and the development of the country. You want to make sure that they get it first, they get it soon, and that it costs less. It's less expensive. When I talk about cost, I don't mean financial, I mean cost to your lives. So it's important to provide it early, and it needs to be more controlled and managed rather than it'll happen anyway. We could say that about education, right? Let's close all the schools. People will learn anyway, but that's not the way learning happens or should happen. Sorry. Okay. I hope I satisfied you.
Yes, ma'am. Yes, ma'am. My next question is usually in villages, lower class people tend to have more children because of their mentality of more hands, more income, which is also backward and economically incorrect. They have to feed more people than they are capable of. This eventually leads to the deterioration of the child and the mother's health because of multiple pregnancies, as you have stated earlier also, and makes them prone to many diseases. What is a possible solution to this?
It's a great question because it carries a very big assumption that more children, more income is tied to rural agrarian sectors of society. Actually, the realities of that sector are changing. Mechanization of agriculture and the spread of education has helped considerably to dispel the myth of more hands leads to more income. It's starting to change. We can see the shift. And the more education we provide in the rural areas and the more we mechanize agriculture, the less you're going to have this problem. I see many countries have already moved on from here. And I think even India is starting to move from there. I think the data can be used to dispel this myth that if you have more children, you're actually going to earn more income. There's plenty of data to prove you don't need that. There are other ways in which you can have more income. And actually, if you have more children, those children are going to suffer because there's going to be less to eat for them. There's going to be less resources for their education and for a brighter future for them. So I think it's often cultural norms lag behind reality. And the cultural norms are that, yeah, having more children is a good thing. But I think in agrarian rural societies, people are more likely to have more children, not because of these beliefs, but because of lack of access. They don't have enough services in the rural areas, which make it really difficult. And it's very awkward for them to talk about it because it's not socially accepted. So how do you get the information and how do you act on it is a real problem. In the more you are socioeconomically deprived and the more you are in a rural setting. And the cultural norms prevent them from acting to limit their family size, even when they are starting to feel that they should be doing it. In a study we did in India, in 2 different organizations I worked in, most of the younger people who were married and had children were having less children, even though their parents were in agriculture. They were having less children and they had aspirations for their children to go into something beyond agriculture. They were not confined to agriculture. They wanted their children to go into teaching, engineering, something different also, consider their options. And part of the problem, their problem was they were not getting the services, they were not getting the guidance. And so many a times they would go into urban areas to get that information and guidance. But some of them were bold enough to do that. Not everybody can be. So I think we need to make those services available more and more in remote areas, in rural areas, and with socioeconomically deprived populations.
All right. So this is the last question. According to the National Family Health Survey, only 36% of women use sanitary pads in India. And the rest of them use cloth and make themselves more prone to reproductive diseases. About 336 million girls and women in India are of a reproductive age and menstruate for 2 to 7 days every month. Yet, the cost of sanitary products is too high. Recently, in November 2020, Scotland became the first country to provide sanitary products for free. What do you feel is restricting the Indian government from taking such a decision?
Well, money is an important reason, but also, when it comes to women and girls, as I told you, money is always a reason. But I think in giving the Indian government some slack, what I want to say that cost of the sanitary products is way too high right now in India. Menstruation is such a normal thing. It happens to every woman, every girl for a pretty long period of their life. Why isn't it normalized? It is not. And it is a very, very strange phenomenon that nobody has questioned before. Making sanitary products cheaper and more easily available, where women can get them easily. They don't have to feel embarrassed to go and buy them from men, for example. Women don't like to buy these kind of products from men. And also easy to dispose of without any embarrassment, will certainly reduce reproductive infections and also the embarrassment that many women and girls face when it comes to menstruation, when talking about it, asking for good products. They don't even want to ask about it because it's a taboo subject. It's an unclean, impure almost subject, the way menstruation has been treated in many parts of the world. India is not the only one. Sanitary hygiene is really important for societal understanding that it's a natural aspect of life. Isn't having a child a natural aspect of life? Why isn't menstruation, which leads to it, because without it, a woman is not going to be able to conceive, a natural aspect of life? We've never bothered to explain that to people. And we've never bothered to talk about it because we think about the bleeding and the pads and all that, instead of this is a natural phase in life and it happens to every woman, happens for several years of her life, and it's important to make sure she gets those services. Many changes have happened in India, though, and I take a lot of heart from all the changes that happen, because I don't think I would last in this field if I didn't see the positives along with the negatives. And there's a lot of promotion now of the use of the menstrual cup. It's a reusable cup that is now being promoted in India. And there are other reusable pads that are coming up, which have red lining and, so they're easy to know what they are. And so the blood doesn't show, all kinds of reasons why these are, but they are reusable. And all of these, the government needs to make available cheaply. It could subsidize them in some form and made available in all parts of the country. My theory often is that some of these things are known better in certain progressive states, and other states that are struggling with socioeconomic issues don't get access to them. And that should not be happening. In fact, those are the ones that need these services. So telling them, giving them the information about it and making it available in a way in which their families will also see the benefits. Say, you can't do anything in India or in most countries where you don't have an individualistic frame of mind. India does not have an individualistic frame of mind yet. People are seen in the context of their communities, their families, their cultural context, their extended family. So if you have to work with the woman, you have to work with all of those people in order to get them ready for this shift and this change and get over the taboo around it. And I think it will encourage the women and their families to make sure that they access these facilities. Normalizing menstruation and elevating menstrual hygiene and cheap and accessible products are really very important to women's lives. In fact, they're like a first step, along with sex education. I would say this is a very important step for a girl to have, because how you approach your menstruation defines how you, at least I can say that about myself, how you define your own self-esteem. If when you start your period, you say, oh God, I've got the curse, I am now, I am ashamed and I have to hide myself, it defines your level of self-esteem. If you come out and say to people, hey, I finally got my period, I have made it, I'm a young woman now. How many women do that? Not very many, because you can't in society. But if you were able to go even close to that, I wouldn't say that far, maybe some can't do it, but even if you are able to go somewhere close to that, your self-esteem is already up as a girl. You're nowhere less than anybody else. Your self-esteem is high, and that's what will help you through life. So other than the aspect of sex education, sanitary hygiene, all of those aspects, I would say a woman's self-esteem and her empowerment will go up quite a notch if we are able to provide these services. But I do want to warn you that many of these reusable services require one thing, which is the headache of many societies. It's access to clean water. In order to have reusable pads, reusable cup, you have to wash them, and you have to wash them in clean water. If you don't have access to water, and especially clean water, that's going to be a major barrier. It's a basic need water is a basic need in period, for everything. But it's often forgotten when such things are developed. So if the government has to provide these, it has to make sure people have the water in order to clean them and wash them. So just wanted to flag that.
Yes, ma'am. So this marks the end of our talk today. Thank you so much for sparing time from your busy schedule and sharing your thoughts with us. I mean, it was really an insightful discussion. We got to know about a lot of things that we are unaware of. Thank you so much, ma'am.
Such a pleasure. I have to tell you, your questions were very thought provoking and they were very well framed and very well researched with a lot of data that I read once and said, oh, I had not realized that it was this. So I was very impressed by the work that you had put in, and I hope this gets to more people, and I hope you will talk to others as well to dispel the myths around, women's health and women's lives.
Yes.
Thank you so much for asking me and inviting me.